Meanwhile, are you aware that the national HIV prevalence rate is now pegged at 1.4% among adults between the ages of 15 and 49 across the country? That was according to the National Agency for Control of AIDS, disclosed by its Director General in Abuja while presenting its reports on the mode of HIV transmission and what the released results indicate. Maria Mohammed reports.
In 2019, the UNAIDS and the National Agency for Control of AIDS estimated that there are 1.9 million people living with HIV in Nigeria. This means that Nigeria now have fewer people living with HIV than previously estimated by the National HIV and AIDS Strategic Framework of 2.8%. With this, the country's future response to epidemics will be guided as the nation has made good scaling up HIV and preventions in recent times. But the agency's report indicates that increase in new adult infections among 4 population groups. There are the never married females, never married males, female sex workers, and men who have sex with men. Together, they account for 91% of new infections among adults. On the other hand, people who inject drugs are estimated to account for 11%, despite representing less than 2% of the total population. Equally worrying is the issue of new child infection due to mother and child transmission, which represents second largest source of new infections, accounting for 22% of all new infections. At this meeting, the agency's research team explains that measures have been put in place to curtail the spread of the virus by creating awareness among young people, sustaining the key population programs. The agency's main focus is to reduce infection rate drastically, even if it cannot be fully eradicated.
In Akwa Ibom, that data was flipped. It was the males, never married males, that are contributing higher. And the other state that did the same thing is the one for Rivers, which is 1, 2, 3, 4, 5, the 5th bar from the bar. We can see that for Rivers and Akwa Ibom, the pattern is the same. We need to target places where young people are meeting, schools, workplaces, garden sports, social media, and the like, where young people are congregating and socializing. Also, our attention needs to be focused on the newborns, ensure that our ANC attendance is upped in the country.
To say that this study now gives us a new direction in terms of where we are going to focus our attention and where we are going to channel our resources more to make sure in the next coming year or 2, HIV transmission is drastically curtailed in the country. There is no way we can get to achieve zero transmission, zero death, achieving epidemic control without finding out these tasks that are running.
Nigerians are advised to do whatever they can to prevent themselves from contacting the virus. Maria Mohammed, TVC News, Abuja.